Hello, this is Julie Moore, Wellness Consultancy, and today I want to share with you about dementia. Dementia is a problem which is occurring in our today's life, especially for those people who have reached above 55. And then let's hear about it. Dementia. When Alois Asima, a German psychiatrist, first described this disease in 1906, it was considered to be relatively rare. Perhaps this was because life expectancy at the turn of the century was 47 years old as opposed to the current figure of 77 years. It is believed that 1 in 5 Americans between the ages of 75 and 84, and almost 50% of those 85 years and older, are now affected. While some people are stricken in their 50s, while others stay unaffected well into their 90s remains a question. While there is no foolproof way to diagnose asthma disease, other than perhaps after death at autopsy, medical science has made several critical discoveries about how asthmas affect and destroy the brain. These mostly have been slowly unfolding over the past 15 years. Something during the late 1980s, scientists isolated and identified a molecule called APP, or amyloid precursor protein. APP is a normal protein that is produced by healthy neurons, and the human body produced at least 3 enzymes dubbed alpha, beta, and gamma secretions that eventually cleave APP into shorter forms. You can remember during the COVID, we had these names about alpha, beta, and gamma. So I think these are causes of a lot of diseases, so not only COVID. Let's go ahead. It is not known when the exact purpose of this enzyme serves, but what is clear is that they can build up in the fluid surrounding neurons to form plaques. The medical community used to believe that individuals with asthma disease produce too many of these enzymes known as A beta, but that is not currently found to be the case. Persons with asthma's disease produce capital A beta at the same rate as a healthy person. Researchers re-examined the issue and found it was not so much the process of build-up in the fluid surrounding the neurons, but one of how these fluids are disposed. In the persons without asthma, a beta usually dissolved after it drifts away from the cell. It was found that sometimes A beta folded into insoluble forms called fibrils, which stick together and form plaques. We all produce some plaques as we go through the aging process. However, the real problem begins when these fibrils trigger an inflammatory response in the brain. What occurs next is that the brain then generates toxic agents called free radicals, which fight off infections. The formation of fibrils causes the same reaction. That is, the free radical kill off both the healthy neurons and fibrils indiscriminately. Most of the current work in Alzheimer's research involves how enzymes, vitamins, heredity, and environmental factors, the use of inflammatory drugs and hormones play a role in the onset of this disease. Treatment is aimed toward preventing the destruction of healthy neurons while storing the production of A beta. Dementia has often been confused with organic mental syndromes, chronic organic brain disorder, rapid onset brain syndrome, slow onset brain syndrome, amnestic disorder. Perhaps no other mental disorder has had more confusion surrounding it in terms of inaccurate terminology and interchangeable names. According to Wiener 1991, the term dementia was derived from using a combination of fragmented Latin words, D, meaning out of, plus mens, meaning mind, plus ia, means state of, and suggests that the person was deprived of their mind. Recent research regarding brain functioning suggests that several important mental functions are localized in specific areas and that injury to these areas can result in certain types of cognitive impairment. Our understanding of the brain has greatly improved. We know the brain is divided into many different components, but in order to do its job, it must function as a well-integrated system. Near 1998, the essential features of dementia is a deterioration of a person's memory, their awareness, thought, and perception, how a person remembers and understands language, and how they learn can greatly affect their lives. The practitioner should consider dementia when the cognitive decline has been present for at least several months and is not a manifestation of fluctuating cause of delirium discussed earlier. Conditions such as Alzheimer's disease oftentimes produce degeneration across many areas of the brain, producing a mosaic of, of cognitive problems. Although cognitive disorders are found in people of all ages, some of them occur more often in older people, in part because many diseases that cause brain deteriorations are more likely to affect the elderly. A 1996 consensus conference co-sponsored by the National Institute of Aging and the Lincoln Institute of Alzheimer's Association, focusing on Alzheimer's disease, recommended uniform evaluation procedures and diagnostic assessment. Age-related cognitive decline is important to consider when making a competence-based assessment. In addition to memory loss, at least one of the following must be present for diagnosis of Alzheimer's: agnosia, the failure to recognize familiar friends, family members, or commonly used objects such as eating utensils. Oh God. Aphasia. The individuals loses the ability to understand written language, yet he or she is still able to comprehend speech. Apraxia. Difficulty coordinating motor behaviors even though the necessary motor functions are intact and the person is physically capable of performing these motor behaviors. Loss of executive functioning, judgment, and impulsive control are affected, and the ability to analyze, understand, and adapt to new situations is impaired. Other cognitive impairment includes the inability to remember events, even those happening minutes earlier, the loss of appropriate judgment about behavior, confusion, and disorientation, or difficulties in accurately perceiving spatial arrangements. As discussed above, the three A's, agnosia, aphasia, and apraxia, tend to be more commonly seen in dementia. They are also most likely to occur later on in person's dementia's experience. Dementia is the reduction or impairment of intellect, emotion, and behavioral functioning severe enough to cause some detriment in socio, occupational, and other important interpersonal areas in the person's life. It is almost as if the person has lost their road map of life. They experience difficulty with short-term memory and to a lesser degree long-term memory. For example, when short-term memory problems occur, the person may forget where they left their purse or wallet, not remember to turn off the stove, sometimes with the food still cooking, or forget to lock the doors before going to bed. Problems experienced with the long-term memory are considered less severe. For example, the person cannot remember where they live or how to get home. Personality changes are often manifested by a lack of appropriate grooming. The individuals might begin to wear their clothing inside out, or sometimes no clothing at all, display a major decline in personal hygiene, including bowel and urinary incontinence, poor oral care, saving, and the overall inability to care for oneself. It is generally this loss of good judgment and lapse previously normal behavior that often prompts family members to seek help. In one of the others' clinical practice experience, a family member described her loved one in the following manner. My mother once could defy for the lingoness of being the Queen of England. She always had such impeccable table manners and social graces. Now, mothers eat butter with her fingers and throws the bread on the floor or tries to stuff peas up her nose. It is often this heartbreak of seeing family members unable to sustain their former standard of behavior that is so tragic for the family to endure, along with the progressive decay of appropriate judgment. The family often describes the heartbreak of losing their family member. In some cases, A person described as easygoing and friendly may become extremely rigid, anxious, hostile, or aggressive. Social workers often encounter families struggling with caring for their loved one at home, having to make the difficult decision to institutionalize a beloved family member with dementia. Usually occurs when there is an excessive amount of nighttime activity, a history of falls and injuries, immobility or difficult in walking, incontinence, and situations of being cared for by a female, usually a relative. Other factors include caretaker burden and depressions, emotional distress, financial worries, loss of work, and family conflict. The second most common type of dementias the social worker may find in practice is vascular dementia, sometimes referred to as multi-infarct dementia. Vascular dementias is caused by at least one stroke. Risk factors include diabetes, hypertension, high blood pressure, heart disease, and medical disorders leading to cerebral emboli. The precise relationship between a cerebral infarct and manifesting dementias requires further research, but an association has been found to exist. By far, the most common type of dementia is Alzheimer's type, which accounts for approximately two-thirds of all dementias seen in the older populations. Making a competency-based assessment is vitally important to both the client and to their family in helping to understand the personality changes that will occur. Even though only one person in a marital relationship is likely to have dementia, it rarely has two or more victims: the affected spouse, the caretaker spouse, and the family. It is important that the practitioner recognize the various warning signs of Alzheimer's. The early stage, memory loss, recent, begins to affect the individual's performance, loss of initiative, mood or personality changes, for example, avoiding family or friends, confusion about where they are, for example, being at home, takes are longer to perform usual chores. The middle stage, increasing problem recognizing family and or friends, escalating memory loss and confusions. Making repetitive statements, occasional muscles jerking or twisting, difficulty in reading, writing, or understanding numbers, problems thinking logically, struggles to find the right ones to express themselves, needs close supervision. For example, they may wander away from home, may exhibit suspiciousness, irritability, or restlessness, may have trouble bathing or with self-care. The late stage, difficulty swallowing, feeding self, and losses weight, does not recognize their family members or lifelong friends, does not discuss familiar everyday objects, for example, how to use a fork or a spoon, becomes incontinent and unable to control bladder or boils, unable to care for self, unable to communicate with others. For example, cannot speak or respond to others. The following vignette will illustrate an example of a dementia Alzheimer's type. Hey, this is Julimwa Wellness Consultancy in Mulela in Theta, Juja in Kiambu in Kenya, Kiambu in Central Province in Kenya, East Africa. Welcome to my sharing and subscribe, like, and comment. I will come back to you. Bye.